We are in the thick of it with the Medicare Advantage AEP, or annual enrollment period, running from October 15th to December 7th. You've probably heard some of the pros and cons of Medicare Advantage, and you may have even heard that Medicare Advantage is really only for you if you're healthy. Now look, it's impossible to make a blanket recommendation because it's kind of irresponsible. However, I will let you know that we do field many phone calls from people who are currently enrolled in Medicare Advantage who have suddenly been diagnosed with some type of more serious medical illness and have found that their Medicare Advantage plan no longer supports their needs. So are Medicare Advantage plans just for the healthy? Well, let's discuss. Now let's delve a little deeper. As I mentioned, Medicare Advantage plans operate on networks, and yes, those networks can be rather restrictive. They offer HMOs and PPOs. HMOs, generally speaking, will be less expensive in that very often your monthly premiums will be lower. However, that's not to say that you certainly can't get a PPO with no additional monthly premium, because many Medicare Advantage plans just require that you continue to pay for your Part B. So HMOs will have less flexibility in that you must have a PCP, which is a primary care physician, and that PCP must provide a referral in order for you to see a specialist. Additionally, with HMOs, you will only have coverage in-network, except in the case of a true medical emergency. So in general, HMOs are probably a little bit more problematic than PPOs if you're somebody whose health is in decline. That's because you don't necessarily want additional hoops to jump through if you need to see a specialist, and certainly if you do need to see a specialist, you don't want to have the additional constrictions of networks placed upon you. You want to be able to go to whatever specialist or hospital is best to treat your condition. Now, of course, this is not the case with PPOs. You don't need a PCP, there's no referrals to see a specialist, and you will have coverage in and out of network. However, coverage out of network does tend to be more expensive. And in general, this can be problematic with Medicare Advantage plans, is that people feel that when they actually have to utilize their health insurance for more extreme medical needs, that they can be rather expensive. Then there is the issue of pre-authorization that I mentioned. And honestly, if you're someone whose health is in decline, this is probably the biggest problem. So because Medicare Advantage plans are managed care plans, you of course need your health insurance permission or pre-authorization to receive any treatment or services that your doctor may recommend. Unfortunately, this can lead to delays. And the sad truth is that if you are in need of major medical care, sometimes those delays can be life-threatening. There have also been countless instances where that much-needed medical care is actually denied by someone's insurance plan. Now, that's not to say that you can't fight it. You absolutely can. However, if you're already dealing with health struggles, dealing with the stress of pre-authorization and denials is certainly the last thing you need. Also, as I mentioned, many doctors and hospitals are simply dropping Medicare Advantage plans. They find them difficult to work with and don't want to continue to contract with them. Now, this can happen at any point during the year. So if you are seeing a specialist and receiving regular care for them for your health conditions and they decide to drop your plan, you're left with little recourse. It's not like just because your doctor has dropped your plan that you can now switch another plan. You need to wait until the AEP. Now, beyond these issues, there are costs associated with Medicare Advantage that can become rather exorbitant if your health is in decline. So let's take a look. So I've just picked 3 Medicare Advantage plans at random to compare. You can see here that these are all plans with no additional monthly premium. You would need to continue to pay for your Medicare Part B, and I have 1 HMO and 2 PPOs. So varying out-of-pocket maximums, this one $6,350. Again, it's an HMO, so that's only in-network. This one has 2 separate out-of-pocket maximums, one for in and out-of-network, one for just in-network. And then this one, again, has 2 separate out-of-pocket maximums, one for in-network, one for in and out-of-network. So you can see that these out-of-pocket maximums can be pretty high. I've seen much lower out-of-pocket maximums, and I've seen higher out-of-pocket maximums than that $11,300. Continue to scroll down. Again, you need to continue to pay for Medicare Part B. Let's take a look at some of the other out-of-pocket costs. So something like your primary care, doctor, or even a specialist is not usually going to be the most expensive. Here's where things can start to get a little bit more expensive. Out-of-network, 20% coinsurance. Depending upon the actual cost of that service, 20% coinsurance can be rather significant. $0 to $300 copay, that could be rather significant. Let's continue to scroll on down. Inpatient hospital coverage, so $299 for days 1 through 10. That's
pretty significant if you have to be hospitalized for more than a couple of days. Over here, $374 for days 1 through 8, $395 for days 1 through 5. Those are pretty significant costs. Outpatient as well, also significant. Now, if you look more in depth, you'll get additional costs. So I'm actually going to scroll down again to benefits and costs. Here's what we saw before, limits applied. That's that pre-authorization. Scroll down, a few more benefits. 20% coinsurance, $40 copay. Drug coverage, this is very important. So chemotherapy, it could be 0 to 20% coinsurance. It could be 20% coinsurance if it's out of network. This can be very problematic. I mean, you don't know whether it's going to be free, basically, if it's going to be entirely covered, 0% coinsurance, or if it's going to be 20% coinsurance. For something like chemotherapy that can cost thousands and thousands of dollars and you need regular care, 20% coinsurance could be really significant.
Now, on the flip side, I want to talk about special needs plans, which are offered by Medicare Advantage plans. Specifically, I want to talk about chronic condition special needs plans, which are also known as CSNPs. These are a type of Medicare Advantage plan that are tailored to meet the needs of those who have been diagnosed with one of a very long list of chronic conditions. If you've been diagnosed with one of these conditions, then these plans may actually be a great option for you because they offer those tailored services often at lower rates depending upon the needs of your condition. For example, if you're someone with heart failure, you may have greater access to pulmonologists and cardiologists. Either you're able to see them more frequently or perhaps the copays are lower. Now, of course, we always advise that you work with a broker, but specifically if you are looking at a CSNP because you have been diagnosed with a chronic health condition, then we highly recommend that you work with a broker to determine whether a CSNP or a Medigap plan would be better for your needs. And truthfully, very often our advice is to enroll in a Medigap plan instead. However, this may not always be possible.
We are back on Medicare.gov. I'm putting in that our age is 70 because I want to highlight two things that can really make enrolling in a Medigap plan more difficult. So I'm putting in 70. We're going to update prices based on that. So first and foremost, if you are over the age of 65, then you are going to see that your plans are going to be much more expensive. So even something like Medigap Plan A, which is really not going to offer you great coverage, could be as low as $98, but as much as $329 per month. Let's scroll to one of the better plans, something that's going to offer you more coverage. Medigap Plan G ranges between $90 to $387. And then also let's take a look at Plan N, between $76 to $335. So if you're somebody who ends up enrolling in a plan that's on the higher end of the spectrum price-wise, that could just be completely financially unfeasible. Now, in addition to charging you more if you are over 65, quite frankly, they can deny you outright because if you choose to enroll in a Medigap plan after you turn 65 and enroll in Part B, then you may be subject to medical underwriting, which means there can be higher prices or they can deny you completely. So if you are going to go for a Medigap plan, it's in your best interest to enroll in the 6 months after you turn 65 and enroll in Part B, because during that time, you will not be subject to medical underwriting, which means you cannot be charged more or denied.
So if you are going to enroll in a Medicare Advantage plan, then you can do so either during your initial enrollment period, which is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter, or during the AEP, which is every year from October 15th to December 7th. If you change your mind, Medicare Advantage isn't for you, or you just want to switch plans, then you can do so during the Medicare Advantage open enrollment, which is January 1st to March 31st. And one final set of dates to throw at you. If you are within your first year of enrolling in a Medicare Advantage plan, you're still in that trial right period. So if you want to drop it and make the switch back to original Medicare, you can do so with ease. If you are going to enroll in a Medicare Advantage plan, you can do so in one of three ways. First of which is to use Medicare.gov, which is the website that we just looked at. Your second option is to contact an agent directly. This can be helpful with Medicare Advantage plans because they're offered by private carriers. However, remember, if you do work with an agent, they're a representative of the carrier, which means they can really only discuss with you the plans offered by that particular carrier. And then your last option is to work with a broker. A broker works for you as opposed to the insurance carrier, meaning they can discuss with you a variety of different plans offered by a variety of different carriers. And of course, at iHealth Brokers, we are health insurance brokers. So if you have questions, you can reach us at the comments below or at the number on the screen. We're licensed nationwide. There's no charge for our services. Of course, please make sure to like and subscribe to stay up to date. And if you're still on the fence between Medicare Advantage or Original Medicare and Medigap, I would highly recommend you check out this video below. And if you want to learn more about Medicare in general, there's a Medicare playlist there as well. Thanks for watching, and we'll see you next time.